In this video today, we're going to talk to you about how to deal with that burning sensation in your hands and your feet from peripheral neuropathy, or feeling it in other parts of your body like underneath your rib, into your groin, or down your leg. What's the best option in 2020 and how to get rid of it? Stay tuned.
Dr. Orlando Landrum, a Harvard and Cornell trained MD who specializes in interventional pain, regenerative medicine, and neuromodulation techniques. I've helped thousands of patients be able to get their lives back and eliminate their pain. So, peripheral neuropathy treatment, how to stop the burning. What's the best option in 2020? We're going to talk about some basics about what peripheral neuropathy is, exactly what are some of the treatment options that you can do on your own, and then what's the thing to really look forward to that can help you be able to stop that burning, that tingling, that shooting sensation. So peripheral neuropathy symptoms are traditionally, it comes and goes. It doesn't normally stay there in terms of the pain. It's a burning or shooting sensation, and the area is more sensitive to the touch than what you would normally expect it would be. So what are some of the different neuropathy causes? It can be caused by diabetes in terms of poor blood glucose control and issues that the nerves have. It can be caused by hypothyroidism. It can be caused by injury to the nerves, either from an accident or surgery or fall where there's a crush injury or other impairment to the nerve. It can be caused by toxins like gross alcohol intake that is excessive in nature that can cause problems with nerves. It can be caused by lead or mercury overdosing. It can be caused by insecticides. It can be caused by certain medications like different types of chemotherapy utilized for treatment for cancer, as well as certain antibiotics. And it also can be caused by dietary imbalances such as vitamin E and B12 deficiencies. So different locations are commonly neuropathy is found in the hands and feet, but the other areas can be down the arms, into the legs, into the trunk underneath the ribs, into the groin. Those are some of the common places that neuropathy can be found, and that we'll talk further about what can be done about being specific in the treatment for those areas and those areas alone. So now we're going to have you take a look at this video to get down to the nitty-gritty of understanding peripheral neuropathy, what it's all about, who it affects, and what are some of the severe causes and challenges that it can present to the human body if it's left untreated. The peripheral neuropathy, the good, the bad, and the ugly. So the good is the peripheral nervous system is important with every activity that we look to do. It's comprised of 1 billion cells approximately, and it is made up of two parts. The first is the somatic nervous system, which is voluntarily controlled. If we move our arm or hand, that's what does that. The second is the sympathetic nervous system, which is involuntarily. So how we breathe, how our heart rate functions is the sympathetic nervous system. The bad is the prevalence of disease states to the peripheral nervous system, which is pretty prominent. There's greater than 30 million Americans that have some degree of peripheral nervous system disease. The most common being diabetes, but thereafter are things dealing with chemotherapy from different types of drugs and other medications. Secondarily, also from different disease states that affect the nerves, and they're pretty prominent in nature. So the ugly is that those disease states can cause problems arising from the nerve due to sensation, with issues that affect the nerve, and then after that affect the circulatory system, which results in capillary damage, meaning a small vessel disease, and then thereafter potential problems with infection, ulcers, and gangrene. So traditional treatments include things like medications, like anticonvulsants, like Neurontin, Lyrica as potential options. Blood glucose control, so if blood glucose can be monitored, and specifically hemoglobin A1C can be really well controlled, the likelihood of neuropathy continuing and having other problems can be decreased. Increased exercise, dietary supplementation for those deficiencies that exist, and smoking cessation have all been shown to have improvements in overall control of neuropathic symptoms. So let's talk about kind of the science and the actual tech that's used to treat peripheral neuropathy. So here we have these three different systems. And there's a system of PNS, TNS, and SCS. So what is this alphabet that we're talking about? So PNS stands for peripheral nerve stimulation. TNS stands for transcutaneous electrical nerve stimulation, and SCS stands for spinal cord stimulation. So what does that mean? So PNS is basically targeting that specific nerve that's present with the lead close by it. TNS is shown by this picture of the box with the 4 different patches are applied to the skin, and it's normally targeting the muscles and muscle spasm type elements that are present within the back or sometimes the peripheral joints. And then SCS, as represented by the woman, is a spinal cord lead that's placed inside the back that changes the pain signals that go up to the brain. It's normally a lead that's implanted in the epidural space preferentially, and it sometimes can influence peripheral areas, but normally it has a central basis. So what did we used to utilize to try and target the nerve specifically? And that was that spinal cord stimulator. Instead of placing it in the spinal cord, we would place it in other places. So we'd place it in places like the arm and the shoulder and the brachial plexus to try and target the nerves that are going down into the arm. Or we place it in and around the pelvis to target some of the nerves that would go into both the aspects of the inguinal region or the groin, or components of the glutes, so in and around the butt. To be able to target components of the knee and the sciatic nerve, as well as components of the geniculate nerves that sit in and around the knee. But the downsides were, number one, the leads would never stay in place all that well. Number two, because of the constant motion, the leads weren't built for this. They would have fractures that would take place in them. And then finally, was finding a way to be able to power it. And traditionally, we use the spinal cord stem battery, which is a big honking battery. Most of the times, we had to find a place to place that close to the leads, which is normally a problem for a patient. So nowadays, we have different type of technology that can provide better benefits. So new technology is the Bioness STIMROUTER. So the basic equipment involves the lead that has an anchor point. That's the only thing underneath the skin, nothing else. The battery pack, which is external and is connected via a specific type of Band-Aid. And then the controller, which powers and actually allows for different programming of both the battery pack as well as the lead in order to be able to treat peripheral neuropathy. So the lead, in more in depth and detail, it has an anchor which keeps that lead from moving all around. It has electrodes, which the sensation from the battery as well as the controller is allowed to be able to have input here. It travels down the aspect of the lead and goes into the electrode that's closest to the areas of the nerve in order to be able to apply sensation. So when we look at that in more depth and detail, this is our controller giving a signal to the pulse transmitter that then drives energy in through the skin and the subcutaneous tissues to go into the areas of the muscle where the lead is implanted deep, that's in and around the nerve. So it influences that nerve, stops that burning, that shooting, that tingling, that annoying sensation by providing energy there that changes this nerve from giving a constant firing that's annoying. So what are some of the areas that we can target? We can target the areas of the shoulder. We can target underneath the areas of the rib. We can target the elbow. We can target the wrist. We can target different points that go into the components of the hand. We can be able to target that inguinal region that feeds into in and around the hip, into the components of the thigh, that goes down into the groin. We can target the portions of the knee, target the elements of the calf, coming down into the aspects of the ankle and into the foot. So a whole host of locations that we can be able to target without having to have a big bulky battery, with having a lead that's small, that's flexible, and that can be able to bend with the movements of our body. This is 2020 technology. And so in getting 2020 technology, what we expect is 2020 results. And so what we're able to see is improvements in pain scores where if the best you got before was a 5% improvement, now we're getting a 30% improvement. Or the best we got in terms of walking or ability to work was 8 and 6% respectively. Now we're talking about 48 and 36%. We're talking about sleep that was horrible, and now we're able to improve it by 30%. And enjoyment of life to go from 3% to 36%. We're not talking about major changes that take away everything, but can be impactful without the need for medications and can be impactful without the need for major surgery. This is a procedure that's done using ultrasonography or ultrasound and is a same-day procedure with not a whole host of stitching, not really any cutting, and you can be able to get your life back and be able to do the things that you really want to be able to do.
If you like this video, please hit the subscribe button and also give us a comment on the question of the day. Continue to look out for other videos that really help empower patients and give understanding about technology and treatment options that help patients get their lives back and be able to eliminate their pain. Thank you so much and have a great day.